My name is Jacqueline. I'm Dr. Amron's patient care coordinator. I've been with him for almost 2 years now, and today is my surgery day, and I'm really excited. Today I'm going to be doing mini lipo of the upper outer thighs. It is a problem area that I've had since I was 12 years old, and no matter what I do, diet and exercise, that's the trouble spot. That's the spot that is never going to leave, and I'm very excited to have it taken care of.
I was glad that she asked me, and so I evaluated her, and actually she was not a perfect candidate. And she really falls into the category of what I call mini-liposuction, where it's really 1 or 2 areas done in under 1 hour. Of course, local anesthesia, which is the preferred method that I use. And so in essence, it's mini-liposuction on her.
Dr. Amron has a really unique approach to what he likes to call the aging face, and he really takes his time to evaluate each patient and go through the different ways that the face ages. And because I'm 43, I'm sort of heading that way, and what we're going to do today is we're also going to do fat transfer.
It's also, in her case, evaluation of her face, because Jacqueline's a very pretty girl, but she has some changes that are taking place that can easily be hugely improved without getting into extensive surgical stuff. And I've done little things on Jacqueline over the couple years. I've done Botox on her, a little bit of Restylane and filler in areas. I just did fractional CO2 on her to improve her skin texture, improve fine wrinkling on her. In Jacqueline's case, she was a great candidate for fat transfer. She needed volume replenishment. Fat's a great material to use. And in her case, it's a win-win situation. We did liposuction, we got the fat. The fat can be a perfect material, and it can really last permanently. In most patients it does. How you're looking at light's very important. I see too much highlight here, and I see too much shadowing over here. So we're going to replenish volume in Jacqueline's case, a little up in the temple area, a little in the lateral cheek area. A big area, a very important area to do in Jacqueline's case is this lower eyelid tear trough, as we call it, and the upper middle cheek area to make the cheeks, it's hard to show by pushing, more lifted, so that she's got beautiful eyes, but this shadowing below her eyes really take away. So the fat transfer in her upper middle cheek area and lateral cheeks is very important to do.
Being Dr. Amron's patient care coordinator, I am in a very unique position. I get to see from the beginning to end the entire process. He does really difficult lipo cases. Patients come to see him from all over the world for first-time lipo and revision lipo, and they come to him for a reason, and it's because he's the best. And I really believe in his approach and his technique, and I've seen so many happy patients leave this office over the last 2 years that I've been here that I'm just so excited for myself, and I'm ready to go.
In terms of Jacqueline's surgery, the whole surgery itself, including the mini liposuction and the fat transfer, was about 1 hour and 15 minutes. It's a fairly quick surgery. The first part of it is putting the numbing fluid in, the way I properly numb the area up, but it also hydrodissects the fatty tissue to get a much more pure fat removal for no bleeding and bruising. That took about 15 minutes to do. She felt a little pinching as the fluid was going in. I'm very skilled in terms of how I sneak that fluid in with very little discomfort. And then I used the Adivive system, which is a new system that I incorporate in my practice for fat transfer that I like a lot. It's got a number of advantages. First of all, it's a closed system. The fat is never exposed to the air to reduce the chance of infection, which I've never had anyway, but now it takes it to an even lower level of chance of infection, as well as not exposing that fat to the air itself, so that it has the highest chance of survival in terms of fat grafting. It's a very purified product to transfer that's very clean and has a higher take in terms of survival of that graft into different areas of the face or body. To extract the fat while I'm doing liposculpture itself, for the fat transfer to her face. But this is one very important thing I want to say about fat transfer. People many times forget that fat transfer to areas of the face or the body is really part of liposuction. You've got to pay attention to how well the liposuction or liposculpture is done, and when I'm targeting areas for fat transfer, I'm targeting disproportionate areas, and that's why somebody has to be properly evaluated. in terms of where to target. Otherwise, you can either throw something out of proportion by removing too much fat for fat transfer, put in another area, and create a weird proportion that now I have to redo and do revision work on to reproportion the patient, or they can cause irregularities and indentations. I guess what I'm trying to emphasize is for people doing fat transfer, don't forget that the liposuction is half of it. It's an important part that it's done perfectly. About 30 minutes to do the fat transfer and to precisely place the fat in different levels in her tissue, in different ways, in different directions, in small amounts to properly contour the area. And it's going to look like she had her cheeks in a way kind of elevated, the temple area being softer around her eyes. It's almost going to look a little like her eyes had a little bit of a subtle brow lift and softening around them by the way in which it's going to replenish the volume in those areas. With regard to contouring and filling, in Jacqueline's case, she really was an outstanding candidate not only for liposuction but for the fat transfer like we talked about. But I think people get many times too hung up on exactly what material is used. You know, whether it's Restylane or Juvederm or Sculpt or Radiesse or fat or whatever it is. You know, so much more of it is the artistry and judgment of the person doing it to get to the end point that you want to get to and get a beautiful, natural result in the patients. In her case, fat was an outstanding option, and the fact that she had liposuction done and fat transfer, it's a win-win situation. They go very, very well together. When I'm not going in to do liposuction and somebody wants some facial contouring, many times I will not jump to doing fat transfer. It's a surgical procedure. I'll use many of the other wonderful materials that we now have available to us that is really non-surgical. In terms of Jacqueline's recovery, I mean, quite honestly, the liposuction is going to be very easy the way I do it. She'll go home this evening, she'll take it easy. The fat transfer, she's going to have a little bit of swelling on her face. She probably will have almost no bruising from the fat transfer, and she'll take it easy, have a little bit of swelling for this evening. By tomorrow, most of that swelling should be down, and it's Friday about 5 o'clock, and I'll see her Monday morning at 8 o'clock for work.